Moving abroad. What an adventure. Thinking about it sounds like it'll be fun, but planning it is just overwhelming. Our goal is to help you along the way. Each month, we pick a topic and sit down to talk about it. This month, it's healthcare. Bom dia. I am Alan. We moved abroad 2.5 years ago. We are from the United States. Have you ever dreamt of moving abroad? Wondered how you would do it and whether such a big change is worth it? Then you have found the right channel. With people constantly looking for their next adventure, we want to show the adventure we've embarked on so others can learn from our journey.
Yeah.
Bom dia.
Yeah, we're going through healthcare. We've got a list that, we put together, and obviously it's public care, private care, Serenity, who they are, what they are, why you might be interested.
How they work.
Yep. Nursing homes, end-of-life care, funeral planning, Medicare, for those of you from the U.S., travel insurance, and what we know about Portugal system, Italy, France, Spain, Greece.
How they stack up. Yep.
Okay. So simple enough. I've got my cheat sheets going as usual on this kind of thing. So we wanted to start with public care, keeping in mind that, in the U.S., we're used to private care. That's what we have. But most of the rest of the world have some kind of universal care or public program that is available and, usually ranks fairly well by the World Health Organization. So any of these that we talk about, if you're looking at them, you can go and look in the World Health Organization and see how they're ranking for this year. Okay. One of the things that we always like to remind people is there are a lot of times small co-pays or premiums, and it's different each time, right?
Yeah, for every country, yeah.
And then for non-residents or temporary visitor, you're going to need to purchase private insurance. Okay. EU citizens have a European health insurance card that takes them through all the different countries as they go. Right now, I'm still admitting people, so hang on. So in general, when you're applying, you're going to want to already have your residency, and that's going to be either a temporary residency or permanent residency, depending on which country you're going to. Okay. In Portugal, it's a temporary residency. It's just about 4 months. As soon as you get your temporary residency card, you can go to your local health center. So it has to be the local health center that you live in. You're going to take your residency card, of course, and your proof that from the township that you've gotten from the township that you live in that area, which is essentially a piece of paper that you'll get when you first come here. And that makes a lot of things simple, such as you don't always have to have your passport with you. You don't have, as you're signing up for different things like the Social Security, your health number, different special cards that you can get, discount cards with. This piece of paper just lets it all be on one little piece of thing. Yeah. Right. It's just easier that way. So we had to show, there's always a list that you can find online for your health center that says what you need, but it's very bureaucratic.
Yeah, it's best always to take, if they ask for 4 things, take 8. Right. It's just because it doesn't hurt.
It doesn't hurt. And what I may be asked for in my health center, that you may only ask me for 4 things, but they might not be the 4 things that were on the list. Okay, there might be 3 of those in this extra one. And then he may go and have 4 things in a different something as well. Okay.
So just take as much as you can.
So we just, at the beginning, when we were applying for anything, we just had our little packet of all of our information in a nice big book. And I would just whip out what I needed when I walked in the door. It made life very simple when you first get going with all of this. Then you don't get frustrated because they're not going to give it to you until you show them what they ask you for, regardless of what the website says. Okay. So it's not, it's kind of pointless to have a discussion on that subject with somebody. It'd be like talking to somebody at the DMV, Just don't do it. Smile and say thank you. Obrigada. So that takes us to the Portugal. We wanted to make sure you know that it is free for all legal residents
The public system.
in the public system. Interestingly enough, Madeira and the Azores actually have their own healthcare system. It
Yeah,
is
with the
separate
mainland,
from the
yeah.
mainland Portugal. But when you are in mainland Portugal, you're still covered.
Sure.
Okay.
Because you're still in Portugal.
Because you're still in Portugal. Residents do pay a small contribution for their treatment costs in the public system. You may have to pay $2 or $4 for your services.
Small, yeah.
Coverages include all things like all your medical procedures like preventative care, maternity care. You would go to the public system if you had a heart attack or needed a bypass surgery or cancer care. All of those big cares are done in the public system. And one of the reasons is their facilities are designed for that. That's where the state-of-the-art facility will be when you get into the major care.
Mm-hmm. There are a few exceptions on the public system. They would be dental, cosmetic surgery. They don't cover dermatology.
No.
But there's a few things. There's not many that aren't.
Right, but those are the small things. So
Yeah.
major care is going to all be done inside the public system. Interestingly enough, your follow-up care, if you've got your private program, means you can get into your doctor and you get to choose your doctor
With the private.
much quicker.
Yeah.
Okay. Small care like Alan's gallbladder surgery that he just had, that was all done in the private system, because it wasn't something he needed to go to the big system for. So what else did we want to tell you? Oh, in the public system, before I move over, that is actually where your prescriptions come from. So we're used to buying in the United States in our private program. That's where we pick our prescription care.
Yeah.
Right.
And
so
pay extra for it.
Right. And you pay for it and you plan for it. Well, that is done in the public system. So you will want both. When we first came, we actually didn't bother to sign up for the public system for quite a while. We didn't sign up for a while, but what we figured out was they would give a prescription and we go to the pharmacy and they'd say, oh, your number's not on your prescription. The number has to be put on your healthcare number, has to be put on your prescription when the right doctor writes it. So when they print it out, even in the private system, they'll put your public number on there so that when you go, you're only going to pay your $2 or your $4 and not, $10.
Yeah. So you'll take your piece of paper that you got from your community,
Right.
wherever it is, you'll take it out to the doctor, they'll log it into the system, and then they'll enter that in when they issue prescriptions.
Right. And once
it's
they get it
automatically on
logged,
there.
they'll keep it in there for you.
Yeah.
But otherwise, they give you a piece of paper and you actually carry this little piece of paper around with you
Just to
everywhere
make
you
sure.
go.
Yeah.
It's kind of weird. But that works. It works great. Works great. And to give you an idea also, if you have to pay full price for a prescription here, because it's subsidized by the government or negotiated, the prices are negotiated by the government, your full price without being able to use your health number would be about what we were paying when we used our prescription card, our private insurance prescription card. So our copay.
In the United States.
Right, in the United States. So if we had to pay full price for something and it cost us $14, that's about what it was costing here. Okay. So it's very, very affordable, even if you don't have all your ducks in a row. So when we get into the private care, 20% of the residents, and this is just a number that I, somewhere along the line I found, probably Serenity, have private health insurance. There is also private health cards or discount cards.
Yeah.
What we would consider in the United States as a discount card. They sell them here and people think that that's private insurance. I mean, it is, I guess, but it's not. It's a discount card is what it really is. And so if you get a quoted a price of $5 or $10 a month, you're probably paying for a discount card. Okay. So just remember that as you're going down through, and making your decisions. Funchal, here on the island has both a public and a private hospital.
And a new university teaching hospital being built. Very nice facility. It's going to be, but it's a couple of years out before it's ready, but it's going to be wonderful.
Yeah,
So,
it's really
For a
nice.
small island that they have very comprehensive care here.
Yeah, they're building a whole new tunnel to get to it faster.
Yeah.
So it's, it's all well done.
Mhm.
So when you're purchasing your private health care, you obviously want to shop around just like you do in the United States, but they don't have the big programs. There's not a ton. I mean, there's only 11 million people here in Portugal. So there's not a ton of insurers. So maybe 10, there's 5 really big ones. So we used a broker, and that's simply so that the broker could run the numbers with all of them, and versus us having to call a bunch of different people. What we discovered in our things is obviously determining factors are, going to be age, in our case,
Pre-existing
age,
conditions.
pre-existing conditions. If you want to travel internationally, you can, get your policy set up that way. Do you need special like mental health care or dental care or vision care? So, you're going to go through all of those determining factors for your needs. Okay. Hence why we use the broker. We do have a broker listed in the vendor list. If you'd like to use him, he's in Lisbon. There's no affiliation there, but let him know because, when we do talk to him, he's like, oh, thank you. So-and-so called. So, brownie points. I don't know what we're going to do with them. Anyway, so understanding your coverage, this group that we're speaking to here, we know that all of you are US, so you understand coverage and private care and making a purchase much clearer than anybody that's used to universal care. But for others that may be watching this, I would like to make sure that we remind them that they need to pay attention to the coverage limits. For example, is it per person or for family? Is your coverage limit 30,000, 60,000, 100,000? If you're in the United States, that would have been, is it $500,000, $1 million, or $2 million, or, right? So the first time they say, oh, 30,000, coverage on your private insurance should be enough. Keep in mind, you're covered for your major things in the public system. Okay. So that's why it's so confusing. However, we went ahead and because I have a family history of very poor health and all of those things and a fear. So obviously we went ahead and chose the higher levels for our choice because that was best for me and my family.
But there are choices. Yeah.
There are choices. Okay. The other thing, keep in mind, when you get into your age goes up, they aren't as well designed. So a lot of the insurance companies, once you get past 65 or so, they'll knock you out of the program. You can no longer qualify.
There's only one after 65 that you're eligible to get, and that's through MGen, and that's it.
Right.
So
right now, MGen's the only one that takes you after 65.
I think on pre-existing conditions.
And for pre-existing conditions.
Yeah.
So you can, if you already know that, then maybe you don't need a broker, then you would, just contact MGen. I think they're going to send you to a broker anyway,
Sure.
But mgen.pt. So that will take us to, I wanted to make sure we spoke to paying attention to what your deductible are, what your deductible is, just like you would in the US. They're anywhere from, $250 to $500 euros a year on your deductible. And for us, that's for a family of 3. And you also want to know if there's a split. The first year we had an 80-20 split. In the US, our insurance had gotten to where all we could afford was a 70-30 split. So needless to say, I was very happy with that.
It was a $15,000 deductible.
Yeah, per person. You don't want to know about that. It was just all bad. It was just bad. If you don't work for the government,
no comparison.
Or you're not a teacher.
And then the second year.
And then the second year.
While we're here,
100% covered 100%. You pay your deductible and you're done.
Yeah. For this
now,
particular policy.
You do have a few little copays. When you go to the doctor, we pay $18.
18 euros.
Or 18 euros. Always translate that for me.
Sorry.
when you go to have a test run or blood work done, or have a a CAT scan, whatever you're doing, you don't then get 4 different bills, one from the hospital, one from the tech, one from whoever owned the machine that, whatever, the cleaning people. I don't know. All the little things. You don't get those. You're going to pay your $15 euros and you're done. You will pay before you leave. And the fun part is you'll skip out the door. I'm going to be so healthy because in the States, now keep in mind, in the States, when we were sick, the simplest answer was, I grew up with a mother that would say, is it an ice cube or a cold wash rag? Meaning, how bad are you? Because if you're really bad, we'll progress to making a bag of ice to stick on it. But we were never going to the doctor. We surely weren't going to the hospital. Anyway, so, terrible way to think of things in life. So deductible for the family. How do you file a claim? Understanding filing a claim is good. Gina, MGen is the only one that takes you right now that I know of. Now, because I haven't explored it in the last, to see if somebody else is opening up, it's worth contacting, Nuno or a broker.
Yeah.
I'm not trying to say Nuno, but contact a broker because they're going to do that for you.
Right.
They'll run that and be able to be very clear about it. And then that takes us to Serenity. And I know we've also, many of you have know what Serenity is and have heard of Serenity. Michael and his wife, Rita, and their partner run Serenity. So for those of you who don't know what it is it's Serenity Portugal.com. And let's see if I can pop this in here. No, I can't. I can't walk and chew gum.
Okay, we'll get it later.
So anyway, there it is. Contact them. What they are is they are an advocate. They are perfect. If you're in the United States and you are thinking about coming and you have any kind of care issues or any questions, or you want to get your arms around and have all of your medical records shipped over, what these guys do is for less than $500 a year, they will act as your advocate. They are not brokers. They do not sell you insurance. What's funny is if you ask them for an insurance company, they're going to send you to the same guy that is on the list from us. So I thought that was funny when we finally met him. And he's like, yeah, we use Nuno at Win. Oh, okay. So do we.
But they'll do things like schedule doctor's appointments for you, consult, with somebody that can direct you in the proper.
They act as your advocate. They're going to schedule the appointments. They're going to go through your documents. They're going to help set you up with everything.
It's a good peace of mind service.
It really
you don't
is.
need to have it forever. I mean, at least for the first year you're here, it's a real good idea. That way you don't feel antsy about it. You just, if any questions, you just direct it to them and they'll help you sort out.
So they assign you a nurse.
Yeah.
Straight out of the gates. They also have a consultation. So if you don't know whether you want to do it, you can sign up. Obviously there's a fee, but you pay the fee for the full consultation. You can start it you could start it after you get here. You can live here for 3 years and decide you want it. So you do not have to make this decision today. However, if you've got really good questions and you already have care issues in mind, contacting them while you're in the States is perfect. Okay, there's my sales pitch. So let's see. So our experience, obviously we have spoken to many different things. I burnt my hand, went to the emergency room. When you go to the emergency room, they, take care of you. When they send you home, they pre-schedule you to get your new bandages. So you don't go from here and then go to CVS and buy all the stuff that you need to take care of yourself. You go back up to the hospital. You have a scheduled appointment. You walk in, 9 o'clock's your appointment. 9:05. They take off the bandage. They wrap you up.
They look at it, make sure it's healing all
Yep.
right, and there's no issues,
Mhm.
and rewrap it, and then you're
Send you
on.
home. And they do that until they deem that you are
Yeah.
healed.
Usually about every 3 days or so.
Regardless. And we had that, with my ear when I got bit by the spider, and then my hand, and then most recently. I think we covered everything else. Do you want to just give them a quick how everything worked for your surgery?
Sure.
That was
I'll tell you briefly about my recent episode about a month ago. I had on a Sunday night at my side started hurting about 9 o'clock. Unbearable. Made the appointment the next morning. Got into my regular doctor that I see 10:30 in the morning at the medical center. He did some initial diagnosis, said that there's something going on. I need to send your information over to the hospital. You need to go get some blood work and a CT scan to see what's going on. There's something going on inside. I can't see through your body to tell. So I went there that same day. It was probably like 2:30 or so. I was over at the hospital, maybe earlier than that. They did the CT scan, and the diagnosis came back that I had an acute inflammation of the gallbladder, and it needed to be addressed. So, and I said, okay, well, I drove myself to the hospital. So I was going to drive home and talk to Leslie about it. And they said, oh, you can't leave because we want to operate on you either tonight or tomorrow morning. I said, oh, so I better try to get a hold of Leslie on the phone and tell her what's going on. So I got a hold of her and told her, and at 5:30, I was in pre-op getting ready to go. And at 6 p.m., I was having my gallbladder out. 7:30, I was in recovery room. Spent the night in the hospital. Everything went well. The doctor came in the next day, looked at me about 3:30 and said, you're healing good. I'm going to release you. You can go home and recoup there. So the next day I was released and went home and did what the doctor told me. And without a hitch, I mean, it was wonderful care. I can't believe how the surgeon was wonderful. The nursing staff, everybody there at the hospital was top notch. So it was a wonderful experience. And the best part is it cost zero because we had private insurance. So
we're not going to get a bill next week.
So yeah, it's all taken care of. There's no mystery bills coming or anything like
the
that.
week
But
after.
anyway, my experience, well, I've been to the doctor many times here just for routine checkups, but man, the healthcare is top notch here. Really, I can't say enough about it.
But I do want to make it really clear. Like all good Americans, no, we didn't go to the emergency room the night before when he was not feeling well.
Yeah,
No, we will wait and go to the doctor tomorrow. It'll
I
be
flopped in
cheaper
bed, didn't
that
sleep
way.
at night that whole Sunday, and couldn't wait for the doctor's office to open Monday morning to call them.
It was like
Something's wrong.
And they're like, "Why did you go to the emergency room?" Because you just don't.
Because.
And yes, we know that you work for an emergency room. You're an
So
ER
anyway.
doctor.
Anyway, that's behind me.
Right. So anyway, we have had nothing but wonderful experiences, and we cannot be, we also believe highly in purchasing a private program.
Mm-hmm.
Okay.
Yeah, just peace of mind.
Until and you can decide that you don't want it later. It
Yeah.
surely won't hurt you.
Yeah, it affords so many different options when you have private insurance.
So what we wanted to zip through real quick is we had, and I think we have been to Greece. Greece has a public system as well. It's
Italy,
not
Spain.
highly rated, right?
No.
So they do recommend, when you are exploring Greece, if you happen to be, that you make sure that you have private insurance. Okay. Public system is very long. The waits are, you need to be very patient. And it's a little longer in all the systems. However, Greece is supposed to be not so good. For those of you that might be interested in Italy, it's ranked as number 2 by the World Health Organization. So I'm really not quite sure how you can go too far wrong. Get the private insurance. It's recommended always, if they have that in that country that they recommend that you get it. They do. There's a little different than the way it works here in Portugal. Is we can all do it in Portugal, and essentially as soon as you have temporary residency.
Right.
In Italy, they have a couple caveats. It's based upon the visa that you have and where you live
In the country, yeah.
within the country. is when you'll get your coverage. Okay. So those two things. So you would, if you would choose Italy, you would want to make sure that you clearly know where you're going to live and you check into that healthcare and when you qualify for their public system. Okay. They also have copays, as well as they are talking about charging expats about 2,000 euros a year. That's not a law yet, but it is something that's been up for discussion there. Essentially, if you think about that, that's about what you pay for Medicare.
Yeah.
So I mean, it's
About
not
200 bucks.
life ending. We keep telling you, you know, our costs are probably, realistically, they're, we say 90%, but okay, maybe they're only 86% lower than what they were in the United States. And
Significantly lower.
right. And we actually go to the doctor these days, which is so much better to get proper care. So all of those things we can't say
So Italy's
better.
really good.
Italy's good. Spain is excellent. They have a good system. It ranks up there with Portugal. One of the things that's interesting, though, is, again, your visa type and where you live can determine when you can apply for the public system. As a retiree, you're required to pay a base fee for 5 years.
There might be
Okay.
a waiting period too for that.
Yes, and I don't know, because it's evidently very much based
Yeah.
upon where you are in Spain. I don't know the time limit on that. So I'm not going to pretend that I do. So France is interesting because Lessa, that's where my stepdaughter lives. So obviously well versed in at least having babies in that system. Works out just fine. And temporary residency, once you've received your temporary residency, which is technically your long stay visitors visa, because they don't have the same kind of visa, so it's not a retirement visa. Then you can qualify, but your costs actually depend upon your income. So you make more, you pay more.
Yeah. Show us the wallet.
Yeah, exactly. It's the whole system is funded through Social Security contributions. Okay.
In France, yeah.
Yeah. So we had some questions already in the list. One of them was nursing homes, which is kind of why we touched on the really nice one here. Keeping in mind, they don't have, what we didn't talk about was they don't have where we commonly see the staged where you can go into a facility and first you have an apartment and then you have, a room, or in your apartment, then you have a care, right? First you're completely on your own. And so there's stages until you get to the end of your life, right? All the way down to full-blown nursing care. They don't really have those kind of facilities here.
But
However,
there is a really nice nursing home that I visited and toured
yeah,
on Madeira, and it's very nice. I mean, it's got all the amenities you'd expect at a nursing home, comparable, high-end, comparable back in the United States, with on 24-hour nursing staff, obviously a good kitchen and a full cook menu, and
view of the water.
Yeah, view of the water.
Really good view
and
of
I
the
think
water.
the prices, don't quote me on this because they may have changed, but for a double occupancy room, I think it was about 3,600 euros a month. And private, I think it's approaching 5,000 euros a month.
And
That's a lot of money, but back in the States, I have a friend of mine that him and his wife own an E4 bed facility, and it's 14,000 a month for a single occupancy. So quite a bit more.
Right. Yeah, and it's not like when we were looking for care for my mom, financially, if you just did what Medicare afforded, you wouldn't put your mother there, essentially, and it's not going to work out for you. And if you found anything that you would consider decent in the Midwest, the facility that we were talking about was in California that his friend owns, but in the Midwest, an entry level, decent facility where you would leave your mom, was 70 grand a year then, 5 years ago. So,
but anyway,
you can buy an awful lot of home health care, but they have big families here, and they still go that route.
Well, they do
multi-generational housing.
They have done it for generations. They got multi-generational homes, and people in the homes take care of each other. So that's just the way it's been done forever. So
exactly.
It's slowly changing.
Right. And then one of the questions on our list is, final days, the end, funeral arrangements, that type of thing. And to be really honest, we haven't looked at it.
No.
We know that we need to.
Yeah.
It is one of those things that, you say, oh, I need to go and you put it off because you don't want to. Right?
Yeah, we'll broach that subject.
So we
soon,
do.
but-
We need to do it. We will go ahead and do it. We need to do it for ourselves.
Mhm.
So we will go ahead and explore that and let you guys know what we discover. We did find a place where you can get the headstones cut,
Yeah.
which is absolutely useless information.
Chock full of nuts can for me, maybe, but
That's what he's getting. And it'll cost you much because I have to have it shipped in from Kentucky.
yeah.
Anyway, so what else did we have on our list? Oh, this is a good one. Carl had asked, he is spending will be spending 6 to 8 weeks a year in the US.
Mhm.
And so,
Also about insurance,
yeah,
going back to the US. And it's basically the same as if you're coming here. You buy travel insurance on Madeira in Portugal to go back to the US. So you're covered on your trip. I recently went back to the United States for 17 days and it cost me for that entire trip for travel insurance was 26 euros for the whole time I was gone. So it's very affordable, but that's the way you cover, short-term trips to the United States. Just like when you're coming here, you have that travel insurance. So that's the way you do it.
and because you're going to have to get reparation, but interestingly enough, they're actually going to ship you back to Portugal. You might want to go back to the US, but you're coming back to Portugal in that case. But he still also has his Medicare A.
A, just the
Not the
major.
B.
I dropped the B.
So he does have major medical if you combine that with a decent travel insurance and you're probably fine. But you would have to decide if, there's a lot of people that do have the ability to maintain their program. My sister and her husband worked for a university and theirs will be maintained, period, for them. They won't be charged. So for them, there is no reason to not just keep what they have. For us, it will just do what we've been doing, which is we keep the Medicare A and we make sure everybody has good travel insurance before we
To
go back home
yeah.
to cover ourselves. Okay. So did we miss anything? What did I miss? I had to go back to my first slide to see. Oh.
Hi, bom dia. Oh, not
Okay.
we went too
We
far.
did miss that.
Too far.
Too far back.
Our Moving Abroad program is coming soon. Let us know what we can help you with. Our programs, Patreon, and affiliates are how we support this channel. They are located in the description of our videos as well as on our website and Patreon. We'd like to take a moment to thank all of our Patreon supporters. Your financial support is truly appreciated, allowing us to create new content. We hope you continue to come along with us on our new adventure. Please like, subscribe, and hit the notification bell to help us grow. The next stage in your life is a journey.